Colon cancer is the second leading cause of cancer death in the United States. And the most heartbreaking part, it is also one of the most preventable cancers we have, if only you get screened. But fear is keeping people away. Fear of the prep, fear of the procedure, and fear of what they might find out. Let me break this all down for you. The myths, the facts, what happens step by step. Who needs to get screened and when? At the end of this video, there should be nothing standing in between you and this potentially life-saving procedure. I'm Dr. Frances Horenstein of Digestwell Health here in Columbus, Ohio. Come on, let's get a deep dive into it. Let's start with the biggest one yet. I need to drink a gallon of terrible liquid. And I hear this every week. And this has stuck from decades long ago, when people actually needed to drink a gallon of solution. That is no longer the case in 2026. Our current guidelines dictate that we do a split dose bowel preparation, and this is what we follow as standard of care. Half of the prep is taken the night before, and the other half is taken in the morning and a few hours prior to your procedure. We also have very low volume options that are more tolerable for those who cannot tolerate the high volume prep. Patients are actually very pleasantly surprised, and they say that it's not as bad after all as how they imagined it. Myth number 2, I will be awake and feel everything. This is no longer true. For these procedures, we use intravenous sedation. So you will be asleep and comfortable during your procedure. You are also able to maintain your airway and breathe on your own. We just give a little bit of supplemental oxygen. So a lot of patients are actually pleasantly surprised, and they ask me, when are we going to get started after the procedure is done? And we tell them, procedure is over. You're on your way to recovery and will be going home soon. Myth number 3, it takes so long. A colonoscopy takes approximately 30 minutes. You just need to have someone to drive you home because you have received sedative. And you will be advised to stay at home and rest all day. Then that's it. Most people are back to normal and can go back to their routine the next day. And here's the part that really puts it in perspective. If you've had a normal colonoscopy, you may not need to have it again in 10 years. That's the current recommended guidelines of interval for average risk individuals. One procedure, 10 years of peace of mind. Myth number 4, and this one is the most dangerous. I don't need a colonoscopy because I'm not having symptoms. Colon cancer develops silently. Most times, early cancers, when it is most treatable, do not show symptoms at all. When we do a colonoscopy, this is our chance to remove small polyps before they even turn into cancer. So what actually happens during a colonoscopy? Let me walk you through it, start to finish. A colonoscopy is a procedure performed by a gastroenterologist. That's me, using a tool called a colonoscope. According to the AGA, a colonoscope is a long, thin, flexible tube about the width of your little finger. It has a tiny camera and light at the end. It's long enough to examine your entire large intestine or colon, all 5 to 6 feet of it, and even the lower part of the small intestine called the ileum. When you arrive, a nurse reviews your medical history and you change into a hospital gown. An IV is placed and you receive sedation. Within minutes, you are completely relaxed and comfortable. The procedure begins after that. I gently guide the colonoscope through the colon, examining the lining carefully for any polyps or abnormal tissue. Here's the important part about polyps. A polyp is a small mushroom-like growth on the inside of the colon wall. Most polyps are benign, but some can become cancerous over time. If I find a polyp during your colonoscopy, I can remove it right then and there. During the same procedure, using tools passed through the colonoscope. That is the power of a colonoscopy. It's not just a screening test, it's also a treatment. Now let's talk about who needs this and when. This changed in 2021, and a lot of people still don't know. The United States Preventive Services Task Force, American College of Gastroenterology, and American Gastroenterological Association all agree screening should start at age 45 in average age adults. This is a change from the previous recommendation of 50 years old. This is because of the rising rate of colon cancers being diagnosed in the younger population. The rate for those less than 50 years old has been rising at 2% every year. So this is no longer a disease of older age adults. If you have a family history of colon cancer, especially in a first-degree relative, and if they were diagnosed before the age of 60, the ACG recommends that colon cancer screening starts at age 40, or 10 years before their youngest age of diagnosis, or whichever comes first. And if you have a history of inflammatory bowel disease, history of ever having polyps, or any of the genetic syndromes that cause polyposis like Lynch syndrome, we even start earlier and screen more frequently. The bottom line, if you are 45 and have never had a colonoscopy, this video is your sign. What happens after? When the procedure is done, which is usually under 30 minutes, you will be going to recovery. You will be watched there for a little bit and you may feel some bloating and gas. This usually lasts about an hour or so. Then you will be good to go home, but you need a driver to drive you because of the sedation you have received. Plan to rest for the rest of the day. And the next day, you can go back to normal activities. And that is genuinely it. Your doctor will discuss the results with you once you're more awake. If we remove a polyp, it will be sent to pathology and it may take a couple of days and we will call you with the results. If your average risk and your colonoscopy is normal, then we'll see you again in 10 years. The myths are scarier than the procedure. And you know what else is scarier? Colon cancer that could have been prevented with a colonoscopy. I'm Dr. Francis Horenstein of Digestwell Health here in Columbus, Ohio. I would love to take care of you and we are taking new patients. And if you know someone, a relative, a friend, or a loved one who is still on the fence and want to know more about colonoscopy, share this video with them. This might be the most important share you would do this year. My link is in the bio to book your appointment today.